Alright, this is the mobility phase for the elbow and wrist. First we have E10, which is active range of motion of the elbow, wrist, and hand in all the planes. So first you just have the patient, we'll just start out with the wrist. We're going to do a little bit of extension, hold that for 5 seconds, we'll push for a little further, and then we'll do some flexion. 5-second hold, and we'll probably do 5 each way just to warm up. Notice he's kind of tensing the muscles up at the end in range. We just want to feel a slight stretch. And then we'll do, We'll hold that position for 5 seconds. Hold that for 5 seconds there. And then we'll do some pronation and supination. We'll supinate. 5 seconds, a little extra push at the end, rotate the wrist over, 5 seconds. And then we'll just do some circles. We'll do a few one direction, counterclockwise and clockwise. And then we'll do the elbow next. So we'll just do some flexion, hold it in range for about 5 seconds. And then some extension for 5 seconds. Alright. Next we will do the wrist ABCs, which is E11. You just have the patient, elbows kind of bent, just going through all the ABCs. Next we have E12, wrist flexion extension stretch. It's important to get the arm straight. He's just going to assist with his opposite hand. He's stretching back. Right now we're stretching these muscles under here. He's holding that for about 10 seconds. He's going to do some stretch the extensors there. Just hold that stretch for about 10 seconds. Working our way to 20 to 30 seconds there. Next, we're going to do the long axis stretch for the forearm. And this one, just use a rope, anything that doesn't stretch out. So he's stepping on one foot, he's got a pretty good grip with the right hand, he's just kind of leaning a little bit, so he's feeling a stretch through the forearm, through the shoulder, even some of the upper track, you might feel that. He's holding that for about 20 seconds. Then he'll switch arms, just kind of leaning in the opposite direction a little bit. 20-30 seconds, controlled breathing, good posture while you do this exercise also. Next we have the wobble board. The wrist wobble board. We're just going to place a ball. We're going to take the 2 nuggets out. The ball just is placed in the middle of the wobble board. We're doing arms straight out. Wrist is in the hand is in the middle of the wobble board. He's going up and down. Just nice and slow, controlled. Then we'll do side to sides. Try to get that board to touch the wall if you can. Then you're just going to try clockwise and counterclockwise. Try and get the rim of the wobble board to touch the wall. Slow, controlled. Alright. And that was E14. Next we have this will be E15. This is the stick work, and we're going to walk over this direction here. Patient kind of, you notice how he uses the table there. Hold that stick. He's gripping with the unaffected hand. You're just going to rub up against those muscles right there. You can do some long 5-second kind of pushes up against there. And he's going to get inside. Flex your muscles right there. Hold that for maybe 5 seconds or so. Sliding up and down the muscle. And that is the elbow and wrist mobility phase.